Welcome to Healthcare Experiences. I am Renee, and thank you so much for tuning into my YouTube channel. If you are looking to start your medical practice or already have a medical practice and you want to learn more about how to properly manage your finances, this is the show to watch. With that being said, let's jump right into it. We are here to discuss finance for medical private practices. And the reason why we're going to talk about this is because, especially during this day and age, a lot of medical providers are actually starting up their own private practice, especially a telehealth type of practice. And when you know how to manage money for your business, is going to allow you to stay in business for a very long time. And the three things I really want to focus on are budgeting, expense, and billing. When it comes to budgeting, this is basically your roadmap that will keep you accountable and honest based on how you're conducting your business, because the budget is going to allow you to kind of estimate, okay, how much revenue do we want to make this current year, especially if you have financial data from years prior. It's always helpful because now you can always know or see, okay, this is how we did last year, but we are going to actually increase our budget by 20-30%, maybe 50% more. If you're a new practice, then you want to look at organizations like the MGMA. They usually have data that you can actually look at practices that are similar to yours and see on an average how much revenue they generate on an annual basis. So that way you kind of have a good idea as to where you might want to be. So in your budget, you want to take account for salary for staff, and for benefits, if you are going to provide that, which I don't recommend for new startups. You want to look at your medical supplies, office supplies, taxes. You want to account for everything that goes into your business or that your business will be using. All right, so for budgeting, the good thing about it is that every month you get to compare what you budgeted compared to your actual finance. And if you're not meeting your budget, then you need to tweak something. Maybe let's look at our billing process. Let's look at our expenses. Are we spending too much in one area? And if you are, can you cut back? And so this really lead us into the expense, where staffing is going to make a lot of your costs right there, because salary is pretty much the bulk of it. It takes a lot of money to pay people, and this is what I highly recommend for any practices, is to look at alternative staffing. And so with that being said, for example, like a company like mine, right, we have employees that are remote workers, and what they do, whether it's billing, credentialing, remote patient scheduling, they can do a lot, and it really costs you a fraction of what it would actually cost you to have somebody in your practice doing the same job. And the nice thing about it, they are very efficient. And so that is something that I would highly look at, especially when you do have a telehealth practice, because a lot of times, providers, they start their telehealth business, but then they realize the amount of work that goes into it, especially from an administrative standpoint. So look at Healthcare Experiences. I guarantee you won't be disappointed. But But anyways, back to our expenses, right? So as you manage that, you want to look at overtime for your staff. You want to make sure that that is minimized as much as possible, and that your staff is respecting that as well too. So if they're working for 8 hours a day, or if they're working for maybe 7 hours a day, then you want to make sure that they have enough to work for that length of time. You want to look at your supplies. Supplies is another big one, but the beauty about it is that you can always negotiate with the vendors, or you can always shop around with other vendors that sells you office and medical supplies. And if another vendor, if they're selling their supplies at a much lesser price, then you can always switch accounts, and that'll help you on savings. And I think when it comes to supplies too, always make sure to use the oldest one first, not expired ones, but oldest supplies first, and put the new ones in the back. And I think have a scheduled interval as to when you are ordering. I find that when you order like every 2 weeks or maybe once a month, it just helps you to track your finances better that way, and especially it's easier to identify if you are spending a lot more than what you should. So definitely keep that in mind. And then last but not least, billing. Billing is huge because this is how revenue flows into the practice, essentially. First and foremost, I think as a provider, when you're contracted with insurance companies, always negotiate for higher reimbursement rates. Never be afraid to ask. And the reason being is that you can be contracted with an insurance company for 3 to 5 years and the rate doesn't change. But guess what does change? The cost of living increase, the prices on your medical or office supplies increase, tax increase. So you have all these other factors that you really cannot control, and cost that is increasing, but yet you're still getting reimbursed the same. And so these are things that you can use to leverage in your negotiation with the insurance companies. But another great way to leverage and really have the insurance ears about increasing your rates is to be able to prove and show insurances that the quality of care that you are providing to your patients actually matches what the national standards benchmark for certain quality care measures are. So whether you're primary care or some other type of specialty, look at the NCQA, and there's other type of organizations out there that have national benchmarks for your specific specialties, and whatever it is, adopt it and start tracking these things, because now you're just giving yourself that much leverage to go to these insurance companies to say, my patient population are actually getting healthier. We have the data to prove it. You also want to prove to insurance that access to care is available to their members, because insurance can take your data, they can take any benefits that you can provide to their members, and they can use that to also promote and try to get more members to under their plan. So that is something that you really want to consider when it comes to your practice finances. So remember this, okay? Finance is all about managing money, and if you can budget properly and always monitor it and track it to see if your actual finances is actually compared to your budget, is where it needs to be, then you are doing good. But if it's not, always remember it's okay to readjust. Don't get scared, okay? But always make the necessary adjustments and put actions behind it. With your expenses, manage that very closely. Look at it on a monthly basis. If you have a consultant or a practice manager that is working with you, make sure to review your expenses and always try to find ways on how to cut the costs as much as you can. And then lastly, your billing. Make sure that as a provider that you're closing out your notes the same day, if not the next day. Make sure those claims are getting submitted properly, so that way there is no denial. I always tell front desk employees to make sure when you are registering your patients, always verify their benefits Sometimes if they have HMO insurances, they may need authorizations. So those are just some key things that you want to keep in mind, so that way you don't have any issues from a billing standpoint. But with that being said, I hope this was helpful. Please make sure to place your comments down below, as I love to review it. If there's any additional information that you would like for me to talk about, I will, but definitely stay tuned on my next video, as I will focus on patient surveys and how that will impact your practice. And with that being said, thank you so much. And again, don't forget to subscribe and hit the notification bell, and I'll see you next time.